I'm Steph.
I'm Nick.
And we're exercise physiologists here at Sporting Wheelies, and we're going to run you through our FES machine, which stands for Functional Electrical Stimulation. So this machine here is very popular here at Sporting Wheelies and is used regularly by a number of clients. In particular, we have a few clients that require student assistance for setup, and this will be part of your responsibility or your duties as a student here on placement. So our FES machine, very expensive piece of equipment, and a little bit technical, but very easy to use once you know how. So you've got a tablet here. This basically will turn on up at the top, and this will give you access to the client's details and things like that, and their program will pop up on the screen. Over here, you have a chest of drawers with a box. In the box is a booklet, and in the booklet is all of our client login details. So each program is specific to the client, so they will need to log in with your assistance to basically bring up the program. In the box as well, you'll find individual pads. These are our FES pads. So we have a couple of sizes. Now these guys go on our muscles, so client muscles, they'll stick on there. Essentially it'll provide electrical stimulation to the muscle to provide a contraction to assist them with cycling, upper or lower body. Primarily you'll be doing lower limb. So I'm gonna demonstrate on Nick now what that looks like very quickly, and I'm gonna come around to the right side to do that. Perfect. So typically a client will come in and they'll push up in their chair. There's a few things that we need to think about with this is that the setup of this bike, basically you've got a couple of anchors here. These guys are going to cross over and hook onto the chair. This is important so that the chair doesn't tip over, of course, and they'll need to do that first. Whilst doing that, they'll also then need to be put into pedals. So these are our pedals for our feet. So we're going to support the back of Nick's leg and foot, and we're going to bring it into the pedal here. Once it's in, we have two straps. We're going to cross these straps over Nick's foot and Velcro them underneath. Once Velcroed, we're going to secure the shin or calf strap, making sure that the soft part of this is on their leg and we're not causing any irritation to the skin. Once that's nice and secure, they're comfortable and the knees at a nice bent angle and they're all good to go, we can then start sticking pads on. So we have a couple of pads. Like I said, we've got a medium-sized pad. Now this one here is typically used on the tibant and the calf or the gastroc. So depends on how you want to do it. You can pop their feet in before or after, but either way the pads need to go on. So we're looking for the muscle bellies here when we do this. So you're going to palpate the muscle belly before you stick the pad on. And then you're going to do both sides. So I'm just going to show you where one tibant goes and one calf goes, or gastroc, again on the muscle belly. So making sure you palpate where they go. Other important thing to note is that the cords here need to be accessible because you're going to plug them in. So making sure that the cords are going out and away rather than in, so they don't get all tangled. We're going to go to a quad and a hammy now. So with the quads, going to use a larger pad. The larger pads are going to go on the muscle belly again with the cord facing out. So again, we go one more proximal and one distal. So this is our distal one, and then we're going to go for a hammy as well. So this one's going to go up underneath. Sometimes you may need to lift the client's leg in order to get it on. Thank you, Nick. Perfect. So now that we've got one of each, obviously you'll need two on each muscle belly, but you're going to plug them in. So you'll find a whole range of these cords here. Now this is what provides electrical stimulation to that pad and therefore the muscle. On their program, they'll have a number allocated to each muscle group. So say 5 is our tibant, we'll look for lead 5, there'll be 2. You'll basically find 5, find the muscle group it's going to go on to, you're going to grab the cord and just push it gently in like that. Once it's in, make sure it's in nice and tight, give it a little extra push and you should be good to go. You're going to connect up all of the leads and make sure that the cords are all out of the way and not caught. Typically we'll get the client to cycle through at least once or twice with your assistance to make sure that they're comfortable and the cords are all fine. Once that's done, they're pretty much all good to go. So that's legs. Now, additionally to that, some clients will go for glutes and lower back. What we're going to do now is we're going to quickly show you how to get them in a position in order to do glutes and lower back. So you'll typically use the smaller medium pads, typically, sometimes large pads. So what I'll do is I'll just show you Nick's lower back and glute, I guess, position for setup. So Nick's going to essentially lean forward as much as possible with my assistance. You're going to lift up the shirt and you're going to stick these pads on next to his spine. So in Nick's case, you're going to pop them next to the spine, obviously on the skin. With the glutes as well, supporting the body, you're going to essentially lift up the shorts, slide your hand down with the pad and stick it on the glute med and posterior glutes as well, gently easing them back until they're comfortable. Again, you'll plug the cords in as well in order to do that. Pretty much that's FES setup. You'll have an EP with you for the first couple of times to show you how this looks, but primarily that's all that's involved.